I had developed this little sore on the bridge of my nose that looked like a pimple, but it was more of an open sore. And so I put triple antibiotic on it, thinking maybe I bumped my nose, and it went away, but then it returned, and I did the same thing again, and then it returned. And after a while, I thought, this isn't normal, so I better see my dermatologist.
And so the first step was obtain a diagnosis, which did show basal cell carcinoma. And what we're doing in Mohs surgery is an office-based procedure where we remove the skin cancer, but then also examine 100% of the margin under a microscope while the patient waits in the office. So what that looks like is we numb the skin just like we did for the biopsy. We remove surgically a piece of tissue that looks to be the skin cancer and then process it in a lab right across the hall, where we can then process that in a special way that we can look at 100% of the margin. Meaning it's kind of like if you were to take a loaf of bread and chop off the crust. You want to look at the total crust because we already know that there's a skin cancer there. We just want to know if the edge is clear. And so that processing takes anywhere from a half hour, 45 minutes. And then we look at it under the microscope. And if it's all clear, we can go in and close the defect that we've made. If it's not clear, we also make a map as we go. So we have the tissue marked with inks so that we know if we still see skin cancer there, we know exactly where it is. And we go back in and just take where we need to clear that tumor. And so that process is done in stages, if need be, until the tumor's clear. And by doing that, there are a couple of advantages. One is we have a higher cure rate. Cure rate with Mohs surgery for basal cell carcinomas is about 98, 99%.
What I would like to say, if anybody looks at their skin and thinks, is that normal? That's your first sign to go see your dermatologist, because if you're questioning it, there might be something going on that you need to have checked out further. I wish I had come a little bit earlier than I did, and now I come every time I find something.
And I'd echo that. Early detection is key. The earlier we can detect the skin cancer, the smaller, presumably, it will be, less aggressive. And so presumably a smaller wound, smaller defect, smaller repair. Sometimes skin cancers are much larger than they appear, and that's the other benefit of Mohs surgery is we're looking at the margin under the microscope. So sometimes skin cancers are a bit like icebergs, and what you see on the surface is not what's there. If you see a spot that doesn't seem to behave as normal, a pimple-like bump or a sore should heal within a couple of weeks generally. And if that's not the case, then it should be looked at.